Hi, friends. This is Dr. Ravi Kampali. I'm an infectious disease, wound care, obesity medicine doctor. I am a practicing physician who is board certified in these specialties and just wanted to bring an idea and an understanding as to why healthcare is going through this trouble. I think today is a unique day for us to talk about this. And the reason being that today happens to be the um, 7th of April 2021, the World Health Day. And now we have seen, obviously, it's being celebrated by throughout the world in the world by a World Health Organization. But we have to understand that there has been significant problems with health disparities and unequal distribution of healthcare delivery processes for whatever reason. But if you're trying to figure out and create a equitable process, I think that has to do with everybody taking ownership of what's going on with them. But then it just comes down for them to understand how and why and in what way to do it. Now, the question just comes down to us also understanding that there is a huge problem in healthcare, and most of it has to do with food insecurity. This is an important article that I wanted to bring to a head to discuss nutrition security in the United States, but also understanding that over the last 30 to 40 years, there has been significant discussion regarding obesity and diabetes that have gone out of control. And the reason for that is what has happened with the nutritional recommendations that have kind of taken over the healthcare processes that have become complicated because of that. Now, we are talking about in the past, we had this hunger insecurity, and basically, this article is published in JAMA. And in the past, there was discussion about hunger, and that shifted to food security. And there was the first ever and the only conference that was held in around the time of 1969 that has happened. And since then on, nobody really talks about nutrition and also the chronic diseases that happen because of nutrition. And it's high time that we look at shifting this discussion from hunger, which has shifted from hunger to nutrition, but food insecurity. But now we have to talk about nutrition security. So, are we doing a good job at nutrition security? I guess not. And that is kind of reflected in the healthcare advice we give to our patients. For example, I just want to bring up this slide. And this is like an amazing doctor. His name is Dr. Bernstein. And he talks about complications caused by glycosylation of tendons. For example, you see a lot of people with diabetes having different problems with tendonitis, and also different things that happen with end products of glycation that line the tendons and cause trouble with problems with fasciitis and carpal tunnel syndrome, and also glycosylation of collagen. Even what happens is the glucose lines the tendons, and people with frozen shoulder have this problem too. So everything is mostly all the neuropathies, including gastroparesis, retina problems, and diabetic kidney problems. All these could be prevented or yet reversed. Now, the issue is, what are we doing? We're talking about healthcare delivery processes, but we're not addressing the root cause. So we can have all the conferences in the world. We have the best cardiologists around helping us keep them people alive. But unless we do something about it, we're not going to be able to take care of this problem. So any questions, please feel free to reach out to me. I'm always on thinking about this clinical process. but also I'm trying to serve and trying to create some real unique solutions for the patients that decide to come and be helped by me. And I'm now in Georgia, in Augusta and Atlanta area. You can look me up and reach out to the office, and feel free to call. And again, thank you very much for taking time. I just thought, because of today's World Health Day, it behoves us to think about where are we going with healthcare and how can we change it, how can we make things better. Again, thank you very much. Take care.